Ulcerative colitis is a chronic inflammatory bowel disease in which abnormal reactions of the immune system cause inflammation and ulcers on the inner lining of large intestine, especially colon and the rectum. Ulcerative colitis can develop at any age, but the disease is more likely to develop in people between the ages of 15 and 30. Ulcerative colitis is closely related to Crohn disease. However, ulcerative colitis is limited to the colon and rectum. Some extraintestinal manifestations of ulcerative colitis overlap with those of Crohn disease, including migratory polyarthritis, sacroiliitis, ankylosing spondylitis, uveitis, skin lesions, pericholangitis, and primary sclerosing cholangitis. Ulcerative colitis always involves the rectum and extends proximally in a continuous fashion to involve part or all of the colon. Skip lesions are not seen. Disease of the entire colon is called as pancolitis. If disease limited to the rectum or rectosigmoid, it is referred as ulcerative proctitis or ulcerative proctosigmoiditis. The small intestine is not involved here. In ulcerative colitis, involved colonic mucosa may be slightly red and granular appearing, or there may be extensive broad-based ulcers. The transition between diseased and uninvolved colon can be well recognized. Ulcers are aligned along the long axis of the colon, but typically do not replicate the serpentine ulcers of Crohn disease. Isolated islands of regenerating mucosa often bulge into the lumen to create small elevations. They are called as pseudo polyps. Chronic disease may lead to mucosal atrophy and a flat, smooth mucosal surface lacking normal folds. Unlike in Crohn disease, mural thickening is absent, the serosal surface is normal, and strictures do not occur. However, inflammation and inflammatory mediators can damage the muscularis propria and disturb neuromuscular function, leading to colonic dilation and toxic megacolon. They are very likely to perforate. Histologic features of mucosal disease and ulcerative colitis are similar to those in colonic Crohn disease and include inflammatory infiltrates, crypt abscesses, crypt distortion, and epithelial metaplasia. And granulomas that were present in Crohn's disease are not present. Clinical features: ulcerative colitis is a relapsing disorder characterized by attacks of bloody diarrhea with expulsion of stringy mucoid material, lower abdominal pain and cramps that are temporarily relieved by defecation. These symptoms may persist for days, weeks, or months before they subside, and occasionally the initial attack may be severe enough to constitute a medical or surgical emergency. More than half of the patients have mild disease, and almost all experience at least one relapse during a 10-year period. Colectomy cures intestinal disease, but extraintestinal manifestations may persist. Thank you for watching. Hope you enjoyed the video. See you in next video. Don't forget to subscribe and hit the bell icon.